We're not turning back. Hold your breath.
All the delegates to kindly be seated. We will move on to the scientific session. Dr. Ravi Doctor, he is the Associate Professor and Head of the Department at Virar Homeopathic Medical College. He has done his post-graduation from Allen College, UK, and is a Fellow of the British Institute of Homeopathy. Certified in Palliative Oncology from the Tata Memorial Hospital and trained at the Berlin Cancer Institute in Integrative Oncology, Germany. He is currently the faculty head at the International Integrated Oncology Training Program, Switzerland, a joint training program conducted by Indo-Swiss doctors in integrative oncology. He is also the honorary homeopathic physician to the Mumbai Police. He has published various national and international papers on the role of homeopathy in cancer. One among them was published and reviewed in the Journal of European Congress of Homeopathy. The role of arsenicum album post-chemotherapy and the role of immunotherapy in cancer at the Swiss Conference of Oncology and at the Tata Memorial Hospital, Mumbai. As a part of social work initiatives, he has conducted many cancer awareness camps in rural India and currently heads the initiative Swachh Bharat, Clean India, Cancer-Free India. He runs a unique cancer wellness center in Kolaba, Mumbai. Lastly, he has been appointed by the Maharashtra University of Health Sciences as a developer for a unique postgraduate certification program in palliative homeopathic oncology. We are very pleased to welcome him on stage and eagerly waiting for him to ignite the young minds of homeopaths here today. Over to you, sir.
Good morning, all of you. I'm Dr. Ravi Doctor from Mumbai. And thank you, the Coimbatore Homeopathic Medical Association, for inviting me on such a beautiful platform. And my journey started yesterday, and today it's at the epitome of greatness, and what I've seen today, it's fantastic. So my dear friends, with a heart welcome to all these wonderful dear students who are sitting, all of you. Please give a big applause to all of you. My dear students, I was like you, sitting right there in the back, listening to these big stalwarts, one of them sitting right here, Dr. Rajendra here. And I remember sometimes we would fall asleep. In those days, we used to have these big auditoriums and big talks which used to be given. And that inspired me. And I would look forward someday when one of you from there, when you all will sit here or you all will stand here and we sitting there, I think that day, everything what we talk today will be accomplished. So thank you very much. I would also like to thank my very dear IHMA friends, especially Roshan Pinto sir, Arul Vannan sir, because of whom actually I have been a part of this world here. So let's begin. I'm going to be talking to you about a very complex disease, a very challenging disease, which I have personally seen journeys of patients. That is where I have written a journey of mine with my patients, how important it is, how we as a homeopathic physician can make a difference in the lives of these patients. So cancer. Has anyone in the auditorium seen a disease like this, either through their parent or um, through their relatives or through a family friend? Can you raise your hands? Anyone? Yes. Okay. So, 1, 2, okay. Yes. Whenever this word cancer comes to us, suddenly we feel the world is finished. We feel everything is gone. There is nothing left. Now my life is going to be no more. Because of multiple reasons. There are so many myths what we feel. We feel that this disease is going to take my life away. This disease is going to be financially very, very burdensome. This disease is going to disturb my quality of life. I mean, everything is finished with this word. But it's not so. There are a lot of things which can be done. There are a lot of things where life can be sustained. But before that, let's understand this disease from some aspects, from the basics of oncology. And then I'm going to talk to you about my journey of this disease. Next slide, please. Sorry. Thank you. Yeah. This is a small disclaimer. There will be certain photographs. If you're not comfortable, yes, you can just shut your eyes, but this is live. This is what we see in our day-to-day clinical practice. And I respect all the pathies. I come from a family background, like I was just speaking to Dr. Sudarshana, and we are 40 doctors in a family. So my name itself is Ravi Doctor. So actually people, they call me Doctor. So they actually, many times they say, is this your name or it is just a designation? No, it's my family surname. So with due respect to all pathies, because after all of us are working towards one very important aspect, which is humanity. So I'm going to be touching on various aspects, that is basics of oncology, role of homeopathy in oncology, and clinical cases. So let's go to basics. Whenever we talk about basics, the first thing what all of us as students or practitioners, we should know cell divisions, what are the different types, then genetic mutations, and the last but most important is immune surveillance. Has anybody seen this movie? I'm sure all the elders are going to look at this movie and say, yes, we have. How many of you youngsters have seen this movie? It's one of the best movies which I have seen. So today I'm going to talk to you on cancer based on this movie, Mother India. A film where Nargis Dutt, that's where Rajendra Kumar and Sunil Dutt. Beautiful film. But what is the significance of this to do with cancer? I mean, how do you correlate? Let's understand through a different aspect. You can see here that this lady in the middle has two sons. One is Sunil Dutt and the other is Rajendra Kumar. And he is holding a stick. And this man is holding like a sword or a katta, what we call in Marathi. Now, I will tell you a little story of this film. Mother India was made way back in, I think, 1950s, post-independence. And this lady who is there in the middle, she undergoes a lot of trauma in her childhood. When she gets married, her husband is basically killed. Her husband is basically tortured. And that's the time she gets two sons. On the right is Birju. And over a period of time, the children have seen what the mother has gone through. The children, so one son, where he understands that yes, what the mother has undergone. On the other side, the other son says, ये मेरी माँ के साथ ऐसे क्यों हुआ? A typical Tamil or a typical Bollywood film वैसे मेरी माँ को जो हुआ है मैं बदला लूँगा, मैं छोड़ूंगा नहीं उनको. So there is a landlord who keeps troubling them. So Birju takes a vow on the right side. एक दिन मैं इसे काट दूंगा, मैं इसको बर्बाद कर दूंगा. Now that is very important to understand. In the middle is the beautiful creation of life, the stem cell, the mother, what we are, the physical body. The mother or one cell divides into two daughter cells. Now these two daughter cells have a potential to carry on work. They have a potential to create a balance, a homeostasis which is created. Out of that, due to multiple reasons what the body has undergone, either psychologically, spiritually, or physically, because of multiple reasons, one of the cell says, no, I am not going to follow the rules. Birju slowly becomes a dacoit. Birju slowly becomes a rebel. Birju is outcasted. He's thrown out from the village. But he's a nice guy. He wants to take a revenge of all that which has happened to his mother. And Birju wants to take so that there is an internal agony which he's going through, which can be outbursted. Birju, so much extent, what happens is, the landlord's daughter, when she's getting married, Birju enters there on a horse. Please watch the movie. And he kidnaps her and he takes her. What happens in the end is the mother takes the gun and she says, I want to kill my son. And she shoots him and he dies. Now this is Mother India. This is your human body. And one cell which does not understand the other cells, that becomes Birju, and that is cancer. And that exactly divides into multiple other cells, not following the rules made by the body, as a result of which the tumor starts to grow, and as a result of which, in the end, it destroys the entire organism or entire human body. And that is where the whole disease is become more morbid or more fatal. So this is one analogy through which I wanted to show you that how one cell. So that is why many times patients ask us, Doctor, मैं cigarette नहीं पीती हूँ, मैं तंबाकू नहीं खाती हूँ, I have a good lifestyle, I have done everything for my husband, I have done everything for the family. Why did I get my breast cancer? Why do I have to suffer? It is because of mutations have gone abnormal. And when that happens, it becomes very, very, very challenging. So, my next slide, please. And that is where the first becomes abnormal mitosis, where the cells keep multiplying. There is no control towards it. And it is all because of a deactivation of a tumor suppressor gene. The mother does not have control over Birju. She keeps explaining, Birju mat kar, Birju hum sab toot jayenge. But Birju nahi sun raha, Birju nahi sunega, Birju mein sunne ki capacity nahi hai. So nature has given us one tumor suppressor gene within us, which basically controls all the growth. And now this tumor suppressor gene has got deactivated. All of us carry, I carry, all of us carry. I was just talking to Birju and Dr. Biju tells me in his family there are multiple people who've undergone cancer. So all of us, we carry the gene. When it gets activated and when the other gene gets deactivated, science does not know, we do not know. So, why? Because we as Indians, we carry a very strong P53 gene, and as you can see, this is a very beautiful photograph of multiple genes which are there in the body. And this is something which is science, this is something which we should know. And lastly, the most important, the mother, the immune system. the immune system cannot control. What the immune system is trying to do is trying to keep everything in control, but it's not coming in control. Why? It's a part of your own body, it's a part of your own system. Army cannot enter into civilian society and kill, but there can be a time where the army is required to kill. So, as you can see that beautiful histology slide up there, so the tumor cells are all sitting. The tumor cells are taking all nutrition. The tumor cells are taking lipids, proteins, carbohydrates, blood supply. This is called angiogenesis. And it takes all of it and it keeps growing and the cells keep growing. And that is what is very important. So your most important immune system in the body is the T and the B lymphocytes. And that was again very important, where even during COVID what we saw is a cytokine storm. We could see all the lymphocytes crashing down. But as soon as the immune system recognizes the cancer, it will destroy it in 24 hours. Because why? There are antigens which are created. And as soon as an antigen created, even the smallest of the allergen or the smallest of the antigen, the antibodies will get created and they would finish off the cell. So this is the first basics of oncology. So what is it? Students, any one of you, what is more important? Abnormal cell multiplication. Why it happens? Because of abnormal genes which have got activated. And lastly, the immune system of the body cannot recognize it. And that is where the whole problem comes. It was in 2018, Nobel Prize was won by two scientists who found out how the immune system can find the cancer. So there is a very important discovery which has happened, which they call it the monoclonal antibodies which got created. And that is where now cancer treatments have changed. Over a near future, I think over the next 10 years, chemotherapy is going to go. Cancer will probably become like a tablet. You get a cancer, you pop in a tablet, and probably the tumor can be controlled. It's because you're stimulating the immune system. Next slide, please. Lastly, part 2 of the basics, we call it the tumor TNM classification. So, always, please remember, doctors, students, whenever in your clinic you get a scan report or there is a relative who comes to you and tells you, Beta, can you see my scan report? Can you see the biopsy report? Can you see the sonography report? What are you supposed to do? And there is a growth which is seen. Please remember, whenever a tumor size is under 2 centimeters, it is still in stage 1. 2 centimeters is stage 1. As soon as it crosses 2 to 5 centimeters, so many times a sonography report will tell gallbladder mass seen 2 into 3 centimeters. So it will give you the exact dimensions. Great, you can still save this patient very well. As soon as it crosses 5 centimeters, the tumor staging has gone up. And as soon as it goes into beyond any 5 centimeters, please remember, as it is, the patient has entered into the stage 3 or the stage 4, where treatment can become very challenging, treatment can become very, very aggressive. Then comes nodes. So as doctors, it's very, very important. Can I just, 1 minute. Come here. So it's very important. It's very important that how do I check lymph nodes? Please remember, go back to your anatomy class. It's very important that you have checked the entire chain of lymph nodes which are there. So if there is a tumor towards the head region, then of course the cervical, the submandibular, the axillary lymph nodes, the entire chain requires to be felt, and not only felt. It is, you have to press your fingers inside to ask the patient, "Darad ho raha hai? Is it paining?" As soon as the patient says, "It's paining." "Yeah, doctor, it was never paining, but once you press, I think, yeah, there is a pain. Why am I having it?" Or especially for women, breast cancers, very, very important. The whole chain gets involved. Go into the axilla. So this is how. You can just hold here. So tell the lady and put the entire arm inside. Go deep inside the axilla. Thank you, doctor. Go inside. Try to press. Why? Because the cancer cells are going to go into the lymph nodes to invade it. And as that slide showed, where the lymphocytes are sitting right there. So as soon as you press there, the patient will tell you, yeah, I'm getting pain. Yeah, I never had this pain before. Very important. If it's an abdominal, please look out for the inguinal lymph nodes. Please inquire for abdominal. So press deep, as a deep palpation, it should go in. And that is what you will be able to detect. So even at a junior level, your clinical medicine is very, very important. In colleges, whenever you get a patient, please see to it, check the lymphatics, because they are the first line defense when it comes to attacking any severe pathogen in the body. So, as a surgeon, he's going to see for N0, he's going to see for N1. So, surgeon can feel swollen nodes, and that is what we can feel. Then comes N2, where the nodes, where the lady or the gentleman himself is going to say, doctor, I'm having this particular lump which I'm feeling. Why is it so? I mean, there is an infection here. So please rule out whether it is lymphadenitis or whether it is a malignant lymph node which is there. Lastly, swollen nodes located and near collarbone. So this is again for breast cancer. Lastly, metastasis. So in our papers, we write down T3, N2, M1 or M0. As soon as it leaves a particular site and it goes into any other sites, it becomes metastatic. So metastasis again can be prevented. Metastasis again has to be diagnosed. Again, why? Because your prognosis is very, very important. Next slide, please. Now, this is how patients come to us. This is exactly how. Now, these are clinical presentations, and these clinical presentations can become very, very challenging. Now, here is a lady who never told anybody that she has a breast cancer. She never told anybody that there is a lump in the breast. Please counsel your mothers. Please, after a particular age, please talk to them. Even for gentlemen, if there is difficulty in passing urine, the first diagnosis, please get a sonography, please get tumor markers, because that can save a life, and that will make a difference, and that will challenge your medical knowledge. Now, here is a lady who comes, and she didn't tell anybody till a time when the daughter-in-law actually said, Mama, what is this discharge you're getting every time the bra has been put to wash? Why is it like this? And that is where we started, and then they got the patient home. By that time, as you can see, the multiple lumps which were there, and it is actually eroding the breast tissue. And this, now it is already undergone more than about 5 centimeters, and this can become very, very challenging, and that is where the whole thing is. Number 2, very, very common in our country, tobacco, where the person will roll the tobacco, put it onto the tongue, and he will keep eating it. Leukoplakias, for the developing into tongue ulcers. In your clinic, any patient who comes who has a non-healing aphtha for more than 15 days, please do not neglect it. You can save the tongue. Otherwise, you're going to lose the tongue as soon as it crosses the border. So, medical science is very, very precise. When it says 5 centimeters, 5.1 centimeter also it's not going to consider. So that is where, if you can see the tongue. Now, again, this is the gentleman who was going to various GPs, B12 injections, oral candidiasis was diagnosed, and was applying ointments, nothing. He came to me, the first thing I put a torch and I said, oh God, there is an ulcer. Since how long you have this? Since about 2 months. Do you eat tobacco? Yes, I eat tobacco. Please, you require to go to Tata right now, or require to go and get yourself diagnosed. Now here, so then that can turn out to be this. Here is a young boy, little boy, going to a homeopathic physician. He is being treated for sinusitis. Why? Because there is an inflammation. So please, doctors, again, very important to use the hand. Use these fingers. Rule number 1, whenever you examine a patient with, sorry, I'll require you here. So whenever you examine a patient, please see to it that when you touch, the touch, if whether it is a soft lump or whether it is a hard lump, anywhere where you feel it is hard, it is malignancy, malignancy, and malignancy. All of you, very important. Please see to it. Now, in this case, this little boy who comes to me, as soon as I touch, and I ask the boy, is it paining? Boy says, no, it is not paining. Have you got an X-ray? Yeah, we've got an X-ray, but the radiologist also has not come in. No, we require to get a scan done. And that's where we find out this boy is actually having a nasal tumor which is growing inside. Very important. Use medical sciences as your investigative tools. My father, he's a pediatrician, and he would always tell me, okay, he knows quite a lot about homeopathy also. What he would tell me, think like an allopath, but work like a homeopath. Remember this all your life. You can write it. Think like an allopath. Why? Your diagnosis, your prognosis, your therapeutic management, everything, think like them. But in the end, it's very important how you're supposed to. Here comes a young boy. One of you we are trying to connect with this boy. Huge lumps. Passed out engineering, looking out for a job, a big lump, goes to a local doctor, could not get diagnosed. The case of lymphoma. This lady, she sends me this photograph about 5 o'clock in the morning. Doctor, since about 5 days I'm passing this kind of urine. Is it okay? I mean, I never had this problem before. Okay, are you having any menstrual bleeding? No, I'm not having any menstrual bleeding. Then why am I passing? Do you have piles? No, I don't have. I don't have piles. Do you have any urinary burning? No, I don't have it. Bladder cancers. Bladder cancers. Tell the patient, always tell the patient, please do not flush. Please do not. See what is there. See the color of the stools. See the color of the urine. If there is a problem, take a photograph, send it to me, and that is where diagnosis can be made. That is where diagnosis can be missed. That is where life can be saved. That is where life can be lost. It is up to we as homeopathic doctors to diagnose. Why? Because we are actually at the front line when these patients, they come to us. This is where they come to us with a problem, and that is where we should be able to diagnose their problems. Next slide, please. So, what is a tumor? So, swelling of a part of the body, generally without inflammation. Very tricky word. Very tricky word. Without any inflammation, caused by an abnormal growth of tissue, whether benign or malignant. As you can see here of this gentleman, he was an alcoholic. It has always been diagnosed. Oh, you have cirrhotic liver, you have been cirrhotic liver. There may be mild ascites. No, this guy is having hepatocellular carcinoma. That's why he's developing this kind of ascites which is there. So, diagnosis, as clinical students, please remember, very, very important for us to diagnose. Next slide, please. Now, again, we are taught this, but how many of us follow a methodical case history? So when Dr. Sudarshana told me, I said, can I change few of my slides? How many students are going to be coming? Because I don't want to just come here and present fancy looking cases and go back. No, this is the reality. Your case history, what you're taught in your medical colleges, your undergraduate level, your postgraduate level, what is it taught? When I worked in Tata for at least 1 month, whether you are a surgeon, whether you are a chief medical, you're learning medical oncology, you're supposed to take case history of every patient who is coming there in the OPD. And that's what trains you. So preliminary data, case history, very important. Origin, duration, progress. नहीं मैडम आप बोलो ये आपको कब से है? कब से है? Doctor, I am having it since 2 months. No, whether it's 2 months or 2.5 months, please be precise. Yeah, actually, doctor, it's been 3 months since the lump was there, but then 3 months. So you know the prognosis, whether the tumor has grown, whether this thing that, so how fast a tumor is growing, it's all very, very important. So original duration and progress, then comes your associated complaints, very, very important. Again, associated complaints. How is your appetite? Okay, how are you feeling? Are you feeling weak? Okay, are you eating well? Everything should be considered here. So associated complaints. Then comes your investigations, your past and ongoing treatment history. Did you show any doctor? Yes, I'm taking treatment under one of the local surgeons. He says, there is nothing to worry. So, no, but has he investigated you properly? No, he said nothing. We will wait for 1 month. No, I think we require to take a second opinion. So please, very important, past and ongoing treatment history, personal history, past history, family history. This is now being considered to be a genetic disease. It's a genetic mutational disorder. Did your mummy, aunt, maternal side, anybody have it? Paternal side have this kind of an illness? Yes, we had it. You require to be investigated. Then comes, this is very important for we homeopathic doctors, psychological history. Did you pass through stress? Doctor, actually 3 months back, there has been an incident which happened between me and my husband, and we filed for a divorce, and after that I'm not been comfortable, and suddenly I started developing this chest pains, but I never knew that there was a lump which is growing. This, as a homeopathic physician, it is very important for us to know. Okay, sometimes we come across women coming out with dysfunctional uterine bleeding, where they would come and say, Doctor, my son has gone to USA and I do not know when is he going to come back. He plans to settle there, and I'm developing this uterine bleeding. For an allopath, this is not important, but for a homeopathic physician, it is very important. Why? There is a dissociation. There is something which is broken in the patient's life, and the psychological history becomes importance there. And that is where you treat the patient holistically, and the patient will believe you. Yeah? And the last is the socioeconomic. And please remember, I will share with all of you, I will share with the organizers a consent form every doctor should have, every doctor should give in the clinical practice, because nowadays we face a lot of medical legal problems, and if this is there, at least you are protected and the science is protected. Next slide, please. Now, हम तो सब बात करते हैं, but patient की ज़रूरत क्या है? वो हमारे पास क्यों आते हैं? Why would they walk into a homeopathic doctor's clinic? Am I an oncologist? Am I going to give chemotherapy or radiotherapy or probably cut open the tumor? Why are they coming? The whole perspective should be known. Sir, can you put the first video, please? I will require a sound. Sound is there. Yeah.
That I had this dreaded disease. I was all alone, and there was nobody with me at that time, and my world I just. So when I first came to know.
Sorry, can you play it again? Yeah.
So when I first came to know about that I had this dreaded disease, I was all alone, and there was nobody with me at that time, and my world the floor just sank under my feet. But very next moment I decided that I'm never letting it, invade my body. I will fight it. No worries, I'm going to be a warrior. It's all about mind over matter. I had seen many
Hi,
things.
मेरा पद्मा राठौड़. I am 58 years old.
I'm going to fight it.
मेरे 2010 में मेरे कैंसर का 2 ऑपरेशन हुए, बहुत बड़े ऑपरेशन हुए कैंसर के रिलेटेड. उसके बाद वो सक्सेस भी हुए, लेकिन उसके बाद जो कीमोथेरेपी चालू हुई वो मेरी बहुत ही ख़राब हुई, और यानी ऐसे हो गया था कि मैं रहूँगी नहीं रहूँगी, यहाँ तक मुझे पता नहीं था. हाय, मेरा पद्मा राठौड़.
So I was 22 when I got cancer, and it was very horrific to go through the process of chemotherapy. It is only with the right amount of holistic medicines, and it was easier for me to manage the pain of chemotherapy. And I always believed in getting better, and that has made me what I have now, fighting this disease and being young and losing your hair, and it was difficult for me to manage all that 9 months of my time. But I've
3 patients. The first lady coming out and say, my floor just sank, as if, of course it will. It's a dreadful disease. Second lady comes across and says, Doctor, that chemotherapy is giving me so much side effects. I can't tolerate. I'm not going to take it. No, my body cannot. Third boy comes across and tells, Doctor, it's very difficult. I can't deal with this. Psychologically as well as physically, I'm breaking down. I am just 22. I've just stepped into life. I have a very pretty looking girlfriend. Everything is going to go. I'm losing my hair. How do I go out? My whole identity is changing. This is where they will come into your clinic to hold your hand. And how we take them across on the other banks is what I will tell you after the break. So see you soon. Yeah, we close for break. Yeah.
We will have a short tea break. I request all the delegates to please.
The tea and the coffee was good. The tea was excellent. Who preferred the tea? How many of you all? Coffee? So, the best part in South India I like is the way coffee is said. It's kapi. And it's truly very amazing with these lovely words. So thank you, and let's resume back. So as you could see, this was the patient's perspective as to what the patient expects out of us when they walk into our clinics, as you could see. Now, moving on, my next slide. Now let's, as a homeopathic physician, what are we supposed to do? Oops. Okay. Now, the homeopathic perspective. Now, as you can see, this young gentleman with this multiple growths on his chest comes to me in my clinic. Now, it's very important that whatever we have studied, from organon of medicine to materia medica to repertorial totality, all of it comes together when you are prescribing. Now, my first thing, what I would like to tell you all is aphorism 72, what Dr. Samuel Hahnemann tells us about the chronic diseases. So what does he say? He says that the chronic disease is a multi-miasmatic disease. Most importantly, it is a slow, morbid process. Now, you can correlate everything with there. So multi-miasmatic, when I tell you multi-miasmatic, as you can see, growths. So there would be psychosis, then there is tissue destruction which is happening. So as you can see, the tissue destruction which is there. So then that becomes syphilitic. Now the tumor is traveling all over, tubercular miasm. So this is very important, where one disease has multi-miasmatic presentations in one person. So it's a slow morbid process. Person does not die immediately with cancer. It's not like a myocardial infarction or a hemorrhage which happens in the brain. It's a slow process. It takes its own time, whether it's 2 years, 3 years, 1 year, it's going to take its own time. Then, the vital force. Whenever we talk about vital force, usually at an undergraduate level, we are challenged. And you don't understand. I mean, because this is the scientific era. I mean, how do you correlate something which is so dynamic, something which is not seen? How do you? But there is something which Hahnemann tried to tell us, very similar like the immune system, very similar like the force which is there inside us, is a vital force which tries to fight and fight. It tries to oppose them at the commencement. And what Hahnemann also writes is helplessly suffers. Please read this aphorism. It's one of my most favorite aphorism, where he has described this disease completely. Then comes, until at length the organism is destroyed. Now, this, when you understand every phase of this miasm, then you would understand, or every phase of this aphorism, and that is where it gives you a deeper understanding into this disease. Now I'm coming to something which is very important. Why do I show you this slide? Why do I show you this slide? This became, so as I told you, I come from a family background of doctors. My father, allopathic physician. My mother is the first MBBS doctor, lady doctor, which came from Gujarat, and the first women's batch which got passed out, and the first MBBS doctor to become the first chief medical officer in Mumbai. Now, so this is my whole family, my brothers, my sisters, all of them. So my father is always challenging, he puts you into a challenge. He will tell you, okay, let me see how this can help. So that's the time I had gone to see one patient, and this patient had a huge mass in his thighs. It is called, cancer has very big names, rhabdomyosarcoma. Don't go into those names, but it is rhabdo, muscles. Okay, then comes the myo, including the myelin sheet was involved inside with the nerves, and a sarcoma. It's a growth which is happening. Now, what happened there, when I could see that, I saw this photograph. It's like a tiger in the grasslands who is watching you. And it is very difficult to tame this tiger, because this tiger is actually destroying the human being there. And this, till you're not trained. So it's like the tiger is looking at, and when I'm looking at the tumor, the tiger is actually looking at me and saying, what is this homeopathic physician going to do when all those big hunters have come and done nothing? I have defeated them, and that becomes very challenging until you do not undergo. And that is where I faltered. That is where I started to fail. That is why my patients, I could not give them relief till I went here. It's the Tata Memorial Hospital, and that is where then I specialized in palliative care, and I am the first one to get certified into palliative medicine from the TMH. And this is my guru, Dr. Mukhadan, who's a pediatric oncologist, the head of the department in Tata, and Professor Emeritus currently. This building trains you. This building trains you to be the NSG. This building trains you how you're supposed to enter a terrorist house and how you're supposed to capture them, how you're supposed to shoot them. This place. So I started my journey here. And once from Tata, then a new journey started. With Tata, then of course I met few doctors there, and I got a chance then to pursue my journey further, and I went to Berlin to pursue my. Now, from here starts a very different journey. So we've understood the cells. All of you all sitting here is going to have a personal journey. Now what I'm going to talk is a journey which I started going through. So I went to the community hospital in Havelhohe. It's a center of integrative oncology in Berlin. We can see that. And then I went to the Lucas Clinic. Dr. Rajendra will tell you how Dr. Kasad, Dr. D.P. Rastogi, all of them have been to these hospitals, got themselves trained, went into research, and these guys, they became stalwarts in treating oncological cases. And that is where I had an opportunity to get myself trained. So about 2 or 3 years I was there, I got myself trained, completely certified, and then I came back to Mumbai. And so these are some photographs where you can see these are all oncologists. This is the whole team under whom I was posted regularly, and the journey continued very beautifully. And that's where I saw something extraordinary. Like, what is this? I have not seen this in India. I have not heard something. Have you heard about Naxwamica injections? No. Have you heard about aconite in a different form? Have you seen Formica rufa? As you can see, aconite Nepalis, 8 ampules. What is this world? What is this? I was newly exposed to this. I have never seen this. I have never heard about this. As you can see, so the patient is managed by multiple formulations. And that, what I could see, was making a difference in patient's life at a different level. The same Naxwamica, but I am not aware of it. So this became a new paradigm for me. This became a new challenge. What is this new thing which I am learning? And that is where I came back, and my first presentation, and this is where Tata had again invited me, because again I got qualified from there. I came back and they had a conference of palliative medicine, and as you can see the TMH, it's a very prestigious auditorium where no one can stand. It's where the Prime Minister sits. It's where Ratan Tata sits. Now on that auditorium where I am called to give a talk, and that is where I'm giving a talk. And the one of the persons in the auditorium, and this is something which I have time and again said. They stop my presentation when I'm presenting, and I'm presenting on arsenic ulcer, and I'm presenting on how homeopathy can help palliatively. So when I'm presenting, one of the surgeon, he gets up and he tells me, hold on, whatever you are presenting is not scientific, whatever you are presenting is all quackery. Somebody else again gets up. Now in Tata, they have a uniform. So the doctors are in scrubs, but the honoraries or the chief are all sitting in the front row. They sit in the white apron. So I could make the difference out. So you make the difference out. Everybody else is in scrub. Medical oncologists, radiation oncologists, all of them. So one stood up saying, "Oh, please, don't talk. This is a scientific platform. In this auditorium is supposed to talk is only science." So I was like, okay, and I stopped, and there the chief is standing there, here, and I didn't know what to do. When you are challenged in an auditorium like this, what am I supposed to do? Do I have some scientific background? Do I have something which... That's the time. One of the honoraries stands up, and he turns around to one of them, and he says, "Which department you belong to?" And that lady says, "So you're questioning me?" "Yes. Which department you belong to?" "Sir, I am from the Department of Gynecology." Then he turns around to another gentleman. "Which department do you belong?" He's saying, "I belong to the hematology." "Okay. What do you give in female uterine cancers? Can you tell me?" So she says, "So we do surgery." He says, "No, what chemotherapy do you give?" He again questions the other fellow who's standing out there. And he says, "Sir, you're questioning me in front of, but what have I said? It's nothing wrong which I've said. This is all quackery." He's saying, "No, whatever I'm asking you, answer." Now he's the boss, so he had to answer. So he tells, "Sir, vincristine, vinblastine." Okay, and we talk about Taxol. They're talking of different drugs. I didn't know. And that's the time Sir looks at them and he says, "Do you know from where these medicines are made?" And they don't know. Neither do I. And he says it is made from a vincristine, vinblastine is made from a beautiful flower called Vinca minora. Vinca minora has been used by these homeopaths for the last 200 years. These guys know it. Learn from them. They know nature. You may know clinical medicine. They know nature. He looks at me and he tells me, "Doctor, please carry on. You are going to face this all your life. Be prepared because this is going to come. But most importantly, work as Hahnemann said, Aude Sapere." Here is a man who's talking, hogging on to me. These guys are very well read, these senior fellows, and it amazed me. So when I went to meet Sir, so there is this pharmacy fellow who used to come to me. And this pharmacy fellow used to have very rare drugs. So one day I asked him, so he's saying, "Ye kisko deta hai tum? Hamesha mere clinic mein aata hai. Whose medicines are these?" And he says, "Sir, wo oncologist hai na, wo use karte hai." "Kaun sa oncologist?" "Tata mein, radiation oncologist." "Oh, really? ठीक है, sir, मुझे मिलेंगे? मिल सकते हैं. Why don't you go there?" Now I go to Tata and I go into the radiation bunker down. And there's a huge queue of patients with different malformations, gross anomalies, and they're all sitting out there. Sir is inside. So the secretary comes and tells me, "You're Ravi, doctor? You had phoned?" "Yes." "Why don't you go and sit in Sir's cabin?" I said, "Okay." And I go and sit in Sir's cabin. What do I see there? Amazed. There is Boning Hussain, there is Kent, there is a repertory, there is Boric, there are homeopathic medicines out there. And I said, "Arey, ye kya chakkar hai yaar? This is something different." And then Sir comes and he sits in front of me. And he's saying, "Yeah, Ravi, tell me, what can I do for you?" I said, "Sir, you are using homeopathic medicines?" Saying, "Yes. Before the patient undergoes radiation, I put 2 drops of causticum and I send them. Some patients I do causticum, some patients I do X-ray, some patients I do radium brom, and I keep a record what is helping them. All 3 of them, they do wonderful magic. They develop less radiation side effect." I'm like, "Wow, sir, but why haven't you published?" He's saying, No. Problem with us is, like your field, people do not accept us and we do not accept you. The day that acceptance will come, we will treat cancer in 1 month. And this is the truth of life. And when I saw that, I used to go to Sir, understood, I used to learn under him, and a new journey started. And what was this new journey? Came the Disha, a new direction. 8-year-old girl having acute myeloid leukemia. I am called for a visit. She's having hematological crisis. Her WBC count is hardly about 1,000 or probably 900. But she cannot tolerate chemotherapy. 8-year-old little girl having that little, the IV infusion in her hand, crying. As soon as I entered the home, she's like, Papa, no, Papa, no. And he says, no, and what are we labeled as? We are called, but I liked it, we are the sweet pill doctors. So, he's saying, Arey, these are sweet pill. He's not going to, no, she doesn't want to. And she's very restless. She's very irritated. And that's the time when I sit there and I open the files and something came across to me. And in those days, there was no Google. Now, everything can be Googled. And this is where I came across as a medicine called Trisonox. So, I go back to the library. I say, what is this Trisonox drug? And that's the time I find out that Trisonox is nothing but arsenic trioxide. Arsenic trioxide is absolutely from where arsenic alb is made. And it is used in promyelocytic leukemia. It's an FDA approved drug. As you can see, Trisonox disrupts the complex, activates P53 cell regulation, and in acute leukemic cells, patients with leukemia, please give a try of arsenic. Trust me, it is going to work because the allopathics are using it as one of the leading drugs in their clinical practice. And we as homeopathic doctors, it's been mentioned in Borix Materia Medica, okay, for malignant conditions, but we don't use it. So this is where a new direction started. So what it does, the chemical molecule of arsenic trioxide is an FDA-approved chemotherapeutic agent used by the brand name Trisonox. Now what does it do? Most importantly, most like other agents, arsenic works by speeding up death of leukemic cells and encouraging normal blood cells to develop properly. It does this by working proteins within the cell and the dual property on one side, killing selective abnormal cells, and on the other side. So imagine a chemotherapeutic drug has dual action. So one side, it's causing cell apoptosis or it's breaking the cell walls. On the other side, it's stimulating the immune system. So why not we start using this drug in chemotherapy became my first challenge. So that is where we started. Now I'm attached with a hospital called the Saifi Hospital, which is a multi-speciality, huge hospital in Mumbai. You all are most welcome to come. Now that's where the tumor board comes. That's where the ethical board comes. They do not allow you to give any medicine unless and until it is approved by the scientific committee. Now, that's where I put my proposal of arsenic alb. Every patient undergoing chemotherapy, okay, why don't we give? And it doesn't have any side effects. So, what symptoms what we took? Now, what are the basic symptoms what a patient undergoes during chemotherapy? Is very common, gastrointestinal. There is diarrhea, there is bowel changes. Then the patient will start feeling tingling numbness in the hand, burning. But the patient will actually tell you, Jalta hai doctor. When the medicine goes in, I feel it's burning. I don't know what to do. So I keep drinking a lot of water. So all of this, when I repertorized, we came across the leading remedy which came out was arsenic alb. And of course, psychological, anxiety, restlessness, hematological, again, leukopenia and thrombocytopenia. And that is where we started to document. So about more than 300 cases of arsenic alb, of chemotherapy were given only a single remedy, arsenic alb, on a protocol basis. And that's where we started to document. Now, so this is my records. As you can see, clinical observation of symptoms which are seen. So cycle 1, it goes up to about 6, then comes. So these are all the graphs what we started to maintain. And then when we started to give arsenic alb, as you can see here, that this is, so cycle 1, then cycle 2. Now these are all the side effects which is seen, and hematological, then comes gastrointestinal. Now blue, as you can see, is gastrointestinal. From 6, it came to 4, but most, okay, then comes the neuropathic, completely reduced, as you can see, okay, and over a period. Now, as the cycles start going, so there are 6 cycles of chemotherapy, there is so much of side effects patients undergo, but what we could see, the conclusion, what we could see, reduction of emesis, diarrhea, and normalizing of gastrointestinal function in 3 days post-chemotherapy. WHO and ECO, what we maintained was 0 in 270 patients, okay? And what we could see, peripheral neuropathy, as you can read here, marked reduction of burning. And last is neuropsychiatric, where it's, again, there was an evaluation by the neuropsychiatry department. This is, sir, these patients taking arsenic alb, they are not developing any anxiety. what have you given? Are you giving a sedative? Are you giving something which is like a diazepam? No, we are not. We are not. It's a basic medicine which is working at different levels of the patient, and that made a scientific progress, and that became science. Today, what we are standing on a platform where philosophy takes a leap into science, and till that is done, you will keep facing battles, you'll keep getting trouble. So when this became science, every patient, why? The oncologist is very happy. The oncologist is saying, "Arey, my patients are not developing side effects, please send them to Ravi, he's going to take care of it." Whatever it may be. Okay? But this, when they got convinced, and this, I remembered that fellow in Tata telling me, and that is very, very important. So arsenic alb for chemotherapy, any of your patients, this is science, or your relatives undergoing chemotherapy, please give arsenic alb, single dose OD, which is given for a 1 week, then a break, and again single dose OD, till the 6 cycles of chemotherapy, and they will not develop side effects, is my word and my guarantee. That is where again, where Sir was there and we presented at various conferences of clinical observation of arsenic. This was in Vienna. Now, that opened for me a new world. ये क्या है? एक नई दुनिया. And what is this new world, new journey? It's a universe. What Sir has given me a very beautiful book today. Please, I would urge all of you all to read. एक दुनिया है, हमको नहीं मालूम है. At undergraduate level and postgraduate level, we are not taught about this. Okay, maybe when you are doing PhD, you start taking up a subject. But this is a universe. And what is the universe about? These are researchers. This is where research happens. As you can see, homeopathy, these are all published articles. You can't challenge them. They're already published in journals of oncology. Please read these articles, and that will give you a new paradigm. That will tell you this is where the science is heading. And you are the science. You are the future. We will perish. We will go. But who's going to take this ahead is you people sitting out there, absolutely from the second row onwards up till the end. This is the future. So please, as you can see, calcarea carb induces apoptosis in cancer cell in p53 dependent via an immunomodulatory circuit. Did you know that? Just imagine such an important gene, so it can modify, it can actually modify that p53 gene, which is actually responsible again, which is for the oncogenes to get triggered. So p53 gene, anti-cancer potential of Conam maculatum against cancer cells in vitro. Drug DNA interactions and its ability to induce apoptosis. Conam, materia medica, first year professor or cell, Conam given in breast cancer. But how does it act, sir? It acts through this. It acts through this cycle. This is science. This is pharmacology of materia medica. And that is very important for all of us to know. Now, here, Viscum album extracts. This is what I'm going to be talking. In vitro cancer of antipotential of Phytolacca dendra 6H and 200C in breast cancer cell lines. Arsenic album leukocytes, sorinum therapy in treating stomach, gallbladder, pancreatic, liver cancer, prospective clinical study. Again, please go through this. Please, in your medical colleges, make a proposal, send it across and start treating, and you will be such a benefit to society. Why? Even an oncologist is going to prefer this, because he's going to say, is there any scientific proof? Give me the proof and do it. This is what you can produce. So, that is where the first time I came across again is what we call as immunotherapy. So every time a patient comes to our clinic and we say, well, doctor, how is homeopathy going to help? Oh, we are going to help improve the immune system. But how is it going to help improve the immune system of the patient? It is because, so what is immunotherapy? So immunotherapy, they are biological therapies used as immunomodulators, are natural body substances which used to treat cancer, Herceptin 2, interleukins, interferon. Now please remember, this is where I'm going to show you interleukin 2, which is now, these are all mediators. These are inflammatory mediators. These are immune cells which triggers the T and B lymphocytes to get triggered so that they can go and capture the cancer cells. Lastly, immunomodulators are helpful in cancer treatments as they have specific action on immune cells. And 2018, where a Nobel Prize has been won. Please go, Google that, see those guys talking on immunotherapy. So initially when I used to talk on immunotherapy in cancer, these oncologists would tell me, but it's not HIV. Well, I mean, how is immunotherapy going to help in these patients? It's not an autoimmune disorder, okay, then why? But now we have proof. Now the whole world is changing towards improving the immune system. And what you could see in COVID, the only thing what got destroyed is the immune system. So, as you can see, there is curcumin, there is viscum album, there is podophyllin, colchicine, capsicum, genistatin. Now these are all molecules present in many of our drugs, and what we use as daily practice, what we use podophyllin, but a very important immunomodulator. How does diarrhea stop? Because I think probably it's improving the immune system, and that's where the immune system kicks in and the diarrhea stops. That's the reason. So where science again is meeting philosophy now. So that is where also I will talk to you about one molecule which I saw them use at a very large extent is viscum album. It's been used, you can use it like a homeopathic remedy. You can use it like drops. There are also injectables which are available. So I use at different levels. And what is more important with viscum album, now these are research slides where your interleukins get stimulated, beta endorphins, and what most importantly what viscum album here does is it causes DNA stabilizing. Very important. DNA stabilize नहीं होएगा, वो cell mutate होते ही रहेगा. Okay, DNA को stabilize कर दिया, इंसान 2 साल नहीं 10 साल जिएगा, cancer उधर ही रहेगा. It is not going to go ahead, and that's where you're going to get an improvement. So DNA stabilization is very important. So people ask, how does homeopathy help? How does it stabilize the DNA? Oh, how? Because of the drugs, because of whatever we do. That's very important. And this is again a chart which is there where interleukins get stimulated, macrophage gets activated, and so on. So, please remember, again a very important side, your classical homeopathy, वो integrate होना पड़ेगा science के साथ में, और science को उनके साथ में होना पड़ेगा. Till the husband wife get married, then only we will have further evolution which will take place. So, classical homeopathy, as you can see, balancing the mind. What is the mind? Why mind? Why do we talk every time about the mind? It is not the mind. It is my neuroendocrine mechanism which I'm helping. I'm stimulating the gene repair mechanism, the immune stability. And so psychologically, we take an entire detailed history. But why are you taking a detailed history? Because of that. And this cycle, when you will start following, that is where you're going to start getting results. So that is where these are called the protocols. This is also there in Banerjee's protocols. You can also see it. You can also read where there are certain medicines which are called the tumor target medicines, a low dose. Then we come to the anti-miasmatic where genetic stability, and last is a constitutional medicine which is going to give rise to homeostasis. So again, I'm not going into advantages. All my slides can be taken, but I'm just going to go. These are some homeopathic therapeutics. You can take a photograph. These are tried, tested medicines, and they work. They do not. Whether it's Phytolacca, whether it's Conam, whether it's Kondurango, all your stalwarts sitting here, they have tried, tested, say it works. It doesn't fail, and homeopathy doesn't fail. So this is something which works fantastic. Tongue, chromic acid, uterus, murex, fuligo, conam, thuja. Now, why have I given this? Please follow symptomatology. Please follow the symptoms. Please follow what Dr. Samuel Hahnemann has said. And then integrate the science along. When the two were integrated, you're going to get results. Now, this is where life becomes a challenge. What do you do when they come into your clinic? How do you help these patients? They come at such a gross pathology. What are you supposed to do? Allopathic systems have said, boss, we can't help. You find somewhere, you go to some alternative therapist and this is, just imagine this gentleman, look at his tumor bulging from the eye, his eyeball is already gone, it's already ruptured inside. Look at that lady with a metastatic breast cancer, so huge, didn't take care of herself. Look at this gentleman, okay, syphilitic miasm, look at that breast tissue, look at this boy with sarcoma, look at this lady with gross ascites, malignant gross ascites, look at this boy, what has he done? He can't suffer. We have to integrate. We have to have that knowledge where we say, okay, now I can treat this. This young girl, it's squamous cell carcinoma of skin. It all started with a small lesion in the nail. And slowly, okay, they went to a local physician, got treated, did not help, went to somebody, squamous cell carcinoma, imagine eroding skin as well as underlying tissues. Finally, the whole hand has gone. Now this, when they come to you with challenge, and that is where your knowledge is very, very important to be integrated. So, now we do case studies. Please, my dear doctors, I may not be giving one dose. I may not be absolutely orthodox. Okay, but at some point of time I use the principles of homeopathy, okay, as when required. Now it is not about winning or losing, it's all about giving a tough fight, and they're holding your hand for it. Please don't let it go. Please respect that, because they have walked into a homeopath's clinic, and be that, not an oncologist. So once you be that, you will immediately be able to transform their lives. So as you can see, so this is a case of acute myeloid leukemia, and I want you to see something which is very, very important. Here is a patient who comes to me with WBC count only 80. Slowly the WBC count went to 30. Slowly the WBC count went to 0. What do you do post chemotherapy? How does the patient go about? Now, as you can see, severe leukopenia which is there in this patient. Okay, during COVID time, they gave me a call. They said that, doctor, you are giving arsenic. The oncologist tells me, I've read about your research paper. Can you help this child? We've given Graphil, we've given everything. It's not helping this child. Can you give something which can stimulate the immune system? Yes, I can. And that is where we started with treatment plan, arsenic alb 30 2-hourly. Now, what was the symptoms? Post-chemotherapy, acute hematological crisis, severe burning on peripheral extremities. Very few symptoms, because sometimes they're pathological symptoms. They are mass symptoms which are there. Soreness in the mouth, fever was there, and something very important, your symptomatology, again very important. With fever, wants covering, and so much fever. The mother would tell me, doctor, she is burning with fever. Burning, little girl, burning with fever. Kya karne ka? And she wants 2 blankets over it, very chilly and very, very restless. And that is where we started with arsenic alb 30. Frequent repetitions is something what we started with. Now, WBC count 80. As you can see, WBC count, as you can see the date, over a period of time, it started to improve. 24 hours. 24 hours. How does this medicine work? How do you get results? 24 hours the child responded. The WBC count shooted up, and that becomes very, very important. Of course, the hemoglobin will remain stable. It takes about 7 to 10 days for HB to go up, but WBC count, which was, so she was actually into hematological crisis, bone marrow crisis, and that is where we could help the child. Now, this is how you're supposed to integrate. My second case is again a triple negative breast cancer. So in breast cancer, whenever they are not hormone sensitive cancers, we call them triple negative cancers. So triple negative cancers become very, very challenging because there is no treatment for it. What does a lady do? Okay, systemic chemotherapy is not going to be working with this lady. So at that point of time, they have nothing. So with that cancer, the oncologist is going to say, I'm sorry, but nothing can be done. Any one of you would be having a triple negative breast cancer. So it becomes very, very challenging. As you can see, right modified radical mastectomy was done, and ER was negative, PR was negative, the 2 main hormones which were negative. And so what we started to do now, this lady who had come, okay, post-surgical, she had developed a huge ulcer. Now, because of that ulcer, it was not healing. So my oncologist friend tells me that, doctor, I think she wants to try some homeopathy through some relative. Can you give something for her just for the healing to happen? And that's where we started with. So as you can see, post-surgical complications, a non-healing surgical ulcer developed at the surgical site with exudative discharge from operative. No response to antibiotics, topical dressing. For 3 months, it just went on and on, which is a long period. So they said, see, I think it is a malignancy which is causing this. Be required to radiate that part. Now she said, doctor, my tissues already open, my breast is so sensitive, you've already removed half of it. Now on that you're going to give radiation, it's going to be troublesome. So they come to me. So we started, so shooting pains, please remember only 2 remedies in breast cancers or with lumps. One is Conam, second is Phytolacca. Pain hai, P for pain, P for Phytolacca. Please write it down. Okay? If there is pain in the breast, then there is Phytolacca. There is no pain in the breast, you give Conam. Now if it is formed into an ulceration, Asteras rubens. 3 remedies only, they work. Now, this lady comes to me. I said, okay, so let's start with, because there is severe pain, there is ulcerations. So we started with Phytolacca 30 OD and Calendula mother tincture as local dressing, which we started onto the breast tissue. First follow-up, second follow-up, okay, the ulcer healed completely, quality of life was much better. And now what does she decide? She decides, doctor, yeah, your medicine works. That becomes very, very challenging for us. Abhi kya karne ka? If the patient goes back to the oncologist and says, I am not going to take chemotherapy and radiotherapy. Homeopathy works for me. It's okay. Now these patients are very, very dicey because the oncologist is going to hate you. अरे इसके पास patient क्या भेजा ये तो यार, these guys, you know, that is why these guys are all quacks. They just take away our patients. So she refuses chemotherapy and radiotherapy now. So again we did repertorization, again followed the same. Okay, we followed up with carcinosin. So she had a family history, strong family history of cancer, non-healing cancers again. So carcinosin comes, and here as you can see, cancer mammae, carcinosin is 1 mark, sepia becomes 2 marks. Now very important, please include the pathology also in your repertory. Okay, complete repertory will tell you, and that is where a complete totality which gets formed, and that is where now there is 14 years survival, which is as compared to medical science, and this is where she is. Yes, this, as an army, they get stars. This hug is our star. Apna life isme ban jata hai boss. Okay, this is where it is. When she comes, she gives a hug, and she very beautiful, gives me a testimonial, and where she very writes, it is heartening to know, as you can see here, I had reached the theatre, at the end of the theatre, when my sister-in-law suggested we meet you a homeopath. They knew, trusted. I had, of course, heard of homeopathy. I knew a lot of people who swore by it, though I had been exposed to allopathic medicine then. All I wished at that point was that my infection be cured. Within a week of taking homeopathic medicine prescribed by you, my infection totally disappeared, much to the amazement of not only us, but Dr. Udvadia. Now, Dr. Udvadia is supposed to be, they come from this hospital called Breach Candy Hospital, which is supposed to be the top hospital of Mumbai, where Amitabh Bachchan, Shah Rukh Khan, everybody goes there. Now, in that hospital, when a doctor is treating you, yes, then it is very, very creditable. And a combination of homeopathy, mistletoe therapy has left very happy. No. Yes. So, it is heartening to know that alternative or non-conventional therapy for cancer exists, which has no side effects and which makes a person feel healthier than even before. I strongly recommend this course to everyone who is affected by cancer. Sadly, a lot of people I know are too scared of going against the allopathic doctrine, as the doctors convince them that the only cure available is the one prescribed by them. So, she says, thank you once again for having been of immense help at a time we needed it. Your treatment has certainly been, what the patient tries, has been an answer to our prayers. This is science meets philosophy meets spirituality. And that connection is very important. So, the other day I was watching this film called, so when I say Avatar, my daughter says, Papa, it is not Avatar, it is called Avatar. So anyways, for us, it is Avatar. So when I was watching the film Avatar, as you can see, that guy, before he flies, they connect the tails into the other tails of the animal, and the whole connection develops. Now that connection is very important, where you connect at a very different level to the patient, and that journey is then lifelong. Now, again, these are some cases which I can just go through. Okay, so again, septicemia tha, patient ko gangrene, peritonitis tha. Okay, prolonged endurance tha, very difficult to treat. Okay, so we started with arsenic alb, followed by chelidonium 6, and with some viscum album preparations. And patients started to do well. Now, in such a case where what I can show you the photographs, where we started with homeopathy, as you can see, it's a huge ovarian mass. Lady, lovely lady, क्या बिगाड़ा है उसने किसी का, such a big tumor coming across, the whole abdomen is all open, you can see the peritoneum, you can see the internal organs, so much of an agony, so much of pain, jaundice which is there, and most importantly, it's a necrotic ulcer. There's so much of malodor, so much of smell. She cannot go out. She cannot even come out of the room. Children don't come near her. Say, Mummy, you smell so much. Mummy, aapse ganda baas aata hai. It becomes very, very psychological. And that is where this whole spirituality gets challenged. Is, God, what have you given me? And that is what, in cancer, what we call as the why me syndrome. And it is very strong, very powerful, where patients want to commit suicide with such this thing. And that is where, how homeopathy helps. Simple remedies. We had started with chelidonium. We started with calendula dressing. We started with arsenic alb. As you can see, slowly, over a period of 7 days, that necrotic mass slowly started to fall up. Okay, the wound looked cleaner. I cannot treat cancer. I cannot remove this whole mass out. But what happened? After 21 days, okay, the wound looks better. It is smaller. Her quality of life came back, she could go back, she could take her children, she could meet them, okay, and she lived for more. The doctors had said with such septicemia, she can only live is for maybe 7 days, 4 months, 8 days, documented, without any complications, and that becomes very achievable for Homeo. 4 times, just imagine how many times where a doctor said she's not going to live, there's no point in giving her anything. Homeopathy made a difference in her life. So, again, so these are different cases, multi-organ failures, okay, again, where you can see where, again, a case of adenocarcinoma, as you can see the final diagnosis, cardiogenic shock, multi-organ failure. In your relatives or anybody in the ICU undergoes a multi-organ failure, the best remedy which can be given post-drugs is Carboveg. Write it down. It works magic. And we gave her Carboveg in the ICU, and she did not want to take any drug because, of course, the doctors are very scared. She's undergone cardiogenic shock, multi-organ. Why? Because of adenocarcinoma of colon. The first chemotherapy collapsed her completely. How is she going to take further treatment? So that is where we started with homeopathy. Of course, so as you can see as the loss of vital power, read Borik's Materia Medica, read Kent's Materia Medica, very beautifully they write, okay, about vital power after drugging, condition of collapse, abdomen is distended, every time she would pass flatus, so a lot of gas, give Carboveg 30 TDS, works wonderful. Then slowly, of course, that is research where it gets combined. So my homeopathic research of adenocarcinoma, as I showed you, that Sorinum 6 therapy, please you can Google it and see it. Sorinum 6 therapy in adenocarcinoma cells works again wonders. And that is where we started. And constitutional was Calgera carb. And what I can show you, adenocarcinoma colon cancers, very aggressive cancers. As you can see, my last report, which is right there, the date is put here, 15/11/2022. I go back to my previous slide, which shows you a date here, where you can see 3/3/2017 is the date of discharge, and now it is 23. So, now as you can see, 6 years evaluation, no disease-related complaints at all, and we have stopped every treatment possible, telling her, now you're cancer-free, just go ahead and enjoy life. You don't require any treatment. We want you to. So getting that patient back into their life became the first priority, and that's what homeopathy did for them. Again, a patient of gross ascites. What do you do for gross ascites? Two wonderful remedies. Materia Medica talks about. One is apocyinum. Cardiac hai to apocyinum. Cardiac nahi hai to acetic acid. Write it in an exam, talk that. Science tested. नहीं है, so cardiac pathology नहीं है, CCF नहीं है, क्या करने का? Acetic acid देने का. Okay, cardiac pathology भी associated है, apocyinum आएगा. Okay, acetic acid. As you can see, when we tap the fluid, this is the kind of fluid which came. Just imagine this lady, huge abdomen. How do you treat this? Now, see ovary again, and with a malignant ascites which comes. So we started with hemorrhagic ascites, pain lean women with wasting. Now this is the acute symptom totality, severe debility, increased thirst, very anxious about her daily business. So you must have heard about a very famous Ganesh idol called the Lal Bagh Ka Raja. They are makers of Lal Bagh Ka Raja, you can imagine. So she tells me, doctor, I and my family, we make the Ganesh Murti. If I am not a part of that, I do not know what is my identity. So the first thing what we did is very anxious about her daily business, and that is one of the symptoms of acetic acid totality, and that's where she is. Hale and hearty, happy. Yeah, good. We could make a difference in her life. As you can see the ascites there. Acetic acid. Okay, and then comes carcinosin 200, long-lasting psychological, lot of depression she had with her husband and the family members, daughter-in-law. Okay, she felt nobody, this thing. She had a young daughter who had passed at a very early age. Inner grief, very important. My psychological history, why cancer has started to develop 20 years back, madam, because you did not express your grief. And that is what has come today. 20 or 25 years later, it's come into you. And that is where Ignatia helps. Followed by Natramure. No recurrent disease and had a fantastic good quality of life of more than 2 years. Now, again, this is again adenocarcinoma lung, where again we could see some changes. So symptomatology, I can just rush through these slides because there is less amount of time. Yeah. Now, in this case, I will just like to show you something. I'm sorry. Yeah. So 75-year-old lady had presented. So as you can see, metastatic, multiple mediastinal, bilateral hilar lymph nodes. Now, 75-year-old lady coming across and saying, "Arey doctor, मैंने तो अपना जिंदगी जी लिया. I have lived my life. Now, how much am I going to live? What am I going to do with this chemo, and all that? Nothing I'm going to do. I'm going to enjoy my life, doctor. You want to give me some homeopathic medicine? My life will continue. Jidhar tak mein jiyegi. My sons, they are working so hard. 2 sons, okay? That chemotherapy budget itself is going up to about 10 lakh rupees. Why to spend? Arey, might as well I give that 10 lakh rupees to my grandchildren. They'll be happy. I don't want. So let my treatment to continue." So then she said, okay, so let's continue with the homeopathic treatment. And we continued with homeopathic treatment. And this was, as you can see, the date up 2016, where all the media cells, so this is a PET scan. So as you can see, I will tell you a little bit about a PET scan. So PET scan is a radioactive scan in which FDG or glucose is injected. Cancer picks up the glucose molecules and highlights them. So that means cancer requires glucose where it absorbs for the ATP cycles. Cut down on the glucose of these patients, and suddenly you will see that patients start to improve. That is where, well, how can you prove it? FDG die as soon as they inject, the glucose is picked up. As you can see, all the lymph nodes will get highlighted, and that is very, very important. Now, in this lady, we started with cobalt met. Again, you can read about cobalt metallicum as a drug, and in complete repertory it talks about cobalt metallicum. And we started, and what we can see is, now I want to go to, so again she had a recurrence in 2018 where all the lymph nodes became highlighted. So another very important drug in oncology, whether it's Hodgkin's lymphoma, non-Hodgkin's lymphoma, or lymph nodes, whenever they come, Carbo animalis, best remedy. Carbo animalis is again a wonderful remedy which can be given in such patients. And what we could see, once we started with Carbo animalis and then her constitutional, and now this is 7th May 2022. Where are the lymph nodes? The radiation fellow calls me and tells me, "What have you given to the patient?" I said, "What? Are you saying, कुछ medicine दिया क्या patient को?" "No, अपना regular homeopathic चालू है." "No, we did the patient scan twice. Where are the lymph nodes? The lymph nodes have all gone gayab. 6 years, boss. 2022, plain HRCT of the chest was performed, inspiration, expiration. Okay, both the lung parenchyma remarkable. There is no significant mediastinal or hilar lymphadenopathy. Where have they gone? What is this? This is miracle. This is magic." But how it has acted, a lot of us have to work towards it. How does Carbo animalis work? What cell cycle did it change? And that is where it became very, very important. So CT findings, or what are the CT findings? Where are this thing? It's nothing which you can see. It says small airway disease. Now that is homeopathy. This is how we could integrate. Okay, so 6 years, patient has lived a beautiful life, and that is where, how we convert the science into philosophy. Now, these are some cases where I could show, and now we would also connect as live to one of our patients where I want you to listen to them. Like you, one of a young boy coming with huge lymph nodes. So we try doing. Any difficulties, any questions for me? This is a good time till our technical team does the job. Yes, anyone from the audience? Please. Have you all understood? Because I'm coming there for Viva questions. Yes, the back row always had a good sleep. It's the best seats ever. Nobody can see what you're doing. Absolutely. Senior doctors, any questions, please? Yes, I'll come to you. Sure, okay. Yes, ma'am. Yes.
So yesterday I received from one of my patient.
Yes.
This is the scan report, sir. Shall I read?
Yeah.
Multiple pancreatic mass lesion with liver secondaries and para-aortic lymphadenopathy. Grossly dilated viscous, probably stomach.
Great. Students. Madam has just given us a case. Okay, so Mayur is there. Okay, that's Mayur. Hi Mayur, Ravi doctor here. Can you hear us, Mayur? Can you hear? Sorry. Hi Mayur.
Sir, your voice is not audible.
Okay, now it is audible?
Voice is not audible, sir.
Okay.
No voice.
Same as the system. Same as the system speakers. Whichever.
Hello.
Hello.
Sir, not audible, not.
Okay, it's okay. You can tell me your story. Yes. Yes. So this is a wonderful
hello,
crowd of
everyone.
doctors, and you are at a very huge conference and a conclave, and we would like to listen to your story. What did you go through when you met me? Please, all over to you, Mayur.
Sir, am I audible?
Yes.
Okay. Hello, everyone. My name is Mayur Mankar. I am from Pune and I am 25 years old. I was suffering from Hodgkin lymphoma from last 6th year, and I met Dr. Ravi last year in 2022 April. At that time, I was critical and disease was widespread. I had big lymph nodes in my armpits, in my left jaw, lymph node of the size of oranges. I also had my left hand was fully swollen and pleural effusion in whole left lung. I was totally breathlessness, not able to walk even for 2 minutes. And at that time, I went to Dr. Ravi. I was afraid to do any allopathic treatment. Dr. Ravi sir encouraged me, and he encouraged me to start the allopathic treatment with and asked me to continue his medicine. With Dr. Ravi sir's guidance, I started allopathic treatment and continued his medicine. I didn't face any side effect. I did high dose of chemotherapy, immunotherapy, and after that, I have also done bone marrow transplant. Everything went easy for me, and also my oncologist told me that I am tolerating well, means all the treatment I tolerated well, and he said many other patients have suffered a lot because of all the drugs, but I didn't suffer a lot because of Ravi sir treatment. And my last PET scan is clear. All thanks to Dr. Ravi sir. Thank you
Thank
so
you.
much, sir.
Mayur, what was the side effects you were experiencing? Yes. What were they? Tell us about it.
During chemotherapy or before chemotherapy?
Before and during chemotherapy, both time. What were you facing? We would like to know. What were your symptoms?
Symptoms in before I had symptoms, totally my skin were totally dried, all body itchiness, breathlessness due to pleural effusion, and big lymph nodes. Size of orange, it were much bigger than orange also. And legs were also swollen. And left hand were also swollen.
Okay. And during chemotherapy, what were you facing? Tell me all those symptoms. Which
During
you, yeah. Sorry.
During chemotherapy, I had very minimal side effect. Mostly nauseated. I used to get nauseated, but that was also only for one day. Where my doctor told me patients suffer from vomiting and nausea for 7 to 8 days they suffer. But I had very minimal side effect during chemotherapy.
Okay.
Also during transplant, also very less side effect.
Correct. Now, before you came to me, you had also taken chemotherapy. Correct?
Sorry, could not hear, sir. Voice is very less.
Before you came to me, you had also taken chemotherapy.
Yes, before coming to Ravi sir, I had also taken chemotherapy, and at that time I got breathlessness. I used to get anxiety, not able to sleep at night, not able to walk due to chemotherapy. Chemotherapy, I was not able to walk even for 1 minute. Also, vomiting, I had lots of vomiting, diarrhea. But during this time, I didn't suffer.
Okay.
Hmm.
Okay. Thank you, Mayur. It was a privilege and an honor to have you. And wish you all the
Thank
best.
you,
You
sir.
have best wishes of everyone here.
Sir, I'm blessed to meet you, sir. Thank you so
Thank you.
much.
Bye.
Thank you, sir.
Bye. Thank you.
Bye, 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 sir.
Yes. Done. Bye. So, you heard the symptoms? Okay? Repertorize them. You'll come to our beautiful remedy. Sir, my presentation. All the lives of so many people. And it's a journey which I have undergone. All of them have a beautiful story to tell me. And this is one of my favorite. Lovely. She got married. She goes for her honeymoon. And that is where she developed uterine pains. Imagine. Uterine pains. And then she comes back to Mumbai. Probably we thought it was honeymoon cystitis or dyspareunia, multiple things. Scan shows uterine cancer. Uterine cancer, and then treating it, radiating it, and is it possible for her to get have babies? Yes, she's just delivered twins last month. And for us, this is what we've been able to achieve. And these are all these lovely people with me here. This was a girl whose case I presented of leukemia. She's now out of it. She's fine. And she sends me this beautiful photo in her lovely selfie, looking like a doll. And this is what we've been able to make a difference in lives of so many people. So now, representing homeopathy at the Tata Memorial again, where they had called me, and these are all international conferences where we've been able to help people and present my work, which is more important. Sir is here. He'll connect with all these photographs because he's been a part of this. So the upper there is where we conduct international training programs for doctors in integrative oncology. So if senior doctors or junior doctors, once you pass out, if you are interested to know more, please join the course. It's a 1-year course where we take doctors back to the Lucas Clinic to Switzerland to see how integrated care is shown in such patients and so on. And it can increase your knowledge. You can start a palliative care center in your clinic because today days are where knowledge is very important. You can help so many patients in your community, in your village, and so on. And lastly, this is my favorite song. If somebody is a good singer, I'm not. This is a song by Coldplay. How many fans of Coldplay here? Yes, so we have Coldplay fans. Very beautiful song where he writes and he says, when you try your best but you don't succeed, when you get what you want but not what you need, when you feel so tired, you can't sleep, stuck in reverse, it's going back, and tears come streaming down your face, when you lose something you cannot replace, when you love someone but it goes to waste. Could it be worse? What more? Enough. Stop it. Lights will guide you home and ignite your soul, and we homeopaths will fix you. Thank you.
Thank you, Dr. Ravi Doctor. The session fills us with great inspiration. I request Dr. Dheeraj Samuel on behalf of CHDA to present the memento to Dr. Ravi.
Afternoon to all. Thank you everyone. And my thanks to Dr. Dinesh, Dr. Dheeraj, Dr. Priya, and everyone here, Dr. Tamarai, because our association is more than 33 years. And we know each other for such a long time. And I'm going to give a very small presentation. And this is related to why we homeopaths. We treat patients, we cure the patients, and something is missing most of the time. And that must be due to our social pressure and the problems are the science itself. And we are in the process of rectifying that problem. And that is what about this. So my dear friends, this presentation is about what exactly homeopathy is. And this is an important question we need to know somewhat. And here, in the morning session, Dr. Ravi has given a beautiful explanation about slowly where we are landing up. We are slowly landing into the deeper and more subtle science, which we never imagined few years before. But now we know what it is. And the younger generation of homeopaths who are budding homeopaths should take the lead and lead the light. We are giving something which we learned in the years. But you have a long time to go and make the life different for the whole humanity. And that is what very important. And this research what I am going to show you is about 12 years of research starting from 2010 onwards. And here we have seen that, I have presented earlier in many places. What is there in homeopathy is one of the biggest questions we had. And as a student in the 80s, as a teacher in the 90s and 2000s, I was really thought about it. And we had some hints came in 2010 from the Mumbai IIT team. They found something in homeopathy. I took the lead and when I started PhD in Vinayaga Mission 2010, I'm so happy to say something because we started a PhD and now PhD is becoming more common all over India and hundreds of scholars are coming and we are so happy to say that homeopathy has taken the lead of research in medicine, which was not there. And that is one of the greatest advantage and greatest learning and greatest contribution to the field of not only for homeopathy but for the medical science per se. And Dr. Ravi was telling about arsenic alb just before as a chemotherapeutic agent. Most of the chemotherapeutic agents in breast cancer are based on, or many cancers are based on arsenic. And people say arsenic is toxic when you use in homeopathy. And the conventional scientists, and they don't have a philosophical background, they have only raw data with them. They don't understand many things. And what they say is, homeopathy after 30 dilution or 12C has nothing, so it is placebo. So it is not useful, don't use it. But when you show the result, when you say arsenic is good for COVID, then they say arsenic is poison. And this is a highly contradictory statement from so-called conventionalists, which we have very clear answer. Now we have very clear answer, not for them, but for the larger society and the larger scientific community. My dear friends, this drug I have studied in 2012-13. And arsenic alb 200, you can see the content of arsenic alb 200. You can see the particles in that 100 nanometer scale of electron microscope HRTM. This is 5 to 60 or 70 nanometer scale particles. And you know that arsenic alb, when it was proposed for COVID as a preventive, lot of people said that it is dangerous, it is producing side effect, it is a toxic material. But you know the size of COVID virus is 130 nanometer. And the size of arsenic alb 200C is starting from 5 nanometer. And majority of particles are within 5 to 20 nanometer size. And we know now how arsenic or other drugs are working. And that's what I'm going to take you a short journey about. And that is I will show you, I have studied more than 250 homeopathic drug samples in electron microscopy in the last 12 years by using field emission scanning electron microscope and high resolution transmission electron microscope with SAED patterns and also especially X-ray patterns. That means EDS, energy dispersion spectroscopy. And here what we find is, I have the drug studied, I will tell you in briefly, from 6C to CM potency, as well as in LM1 to LM30 potency for almost 20-25 drugs. But I don't have time to go everything. It is there in the book Ray of Nanodynamics. Many of you have read it, and the latest edition came from BJN in the last month. And different drugs I am going to show you. Not the same drug in full strength, different drugs. So I show you the arsenic 200. Now I can show you the image of aurum metallicum. Aurum metallicum in 200. And aurum metallicum in every dilution has aurum in it. Every dilution. And mostly the nanoparticle size is less than 10 nanometer. That is in the quantum dot size. Why it is important? This particle has unlimited ability to penetrate into the cell wall, nuclear wall, and finally into the DNA. And many of them directly get attached to DNA. It is well proved recently. And so we know what homeopathy does. And our science is highly advanced, beyond our imagination, which modulates the gene regulation, which are basically epigenetic drugs, which produces epigenetic modification. So my dear doctors, we are not ordinary physicians. We are the physicians making gene regulation. Nobody could imagine it. And that is something which we should understand. That should make us proud. That should make us humble. And that should make us highly confident. We are not second doctors. We are more than what people and society think about us. That's why we are getting marvelous cures. I'm not saying we don't fail, because failure is part of every success. We fail much, but we have excellence in our cure which nobody can imagine. Like Dr. Ravi was telling in the morning, and Dr. Biju is going to talk in the afternoon. We are curing cancers, we are curing autoimmune diseases. Every homeopath sitting here, senior homeopath, they will be having hundreds of experience of curing autoimmune disorders and many chronic diseases. Now we know the reason. So let us go to in a faster way. I will take you to a few of the slides. So this is the ferrum metallicum in the 200C dilution, and the particle size is 2 to 12 nanometer. And again, these all are published in various journals. You can find it in the journals. These papers are there. And this is natramur CM potency. Natramur is such a magical drug. We cure how many diseases with natramur? How many diseases? And this is an island of nanoparticles you are seeing, and the scale bar is only 50 nanometer. And in 50 nanometer, you can find millions of nanoparticles of natrum muriatic. In sodium and potassium, sodium and chloride in ionized form. They are magical particles, directly penetrate into your genetic system and regulate the gene mechanism. And that is why momentarily you cure sometimes patients. And if you go to other drug, natramur this is natramur LM24. And see the particle size 0.65 to 1.15 nanometer. Hardly 5-6 atoms together. When it becomes so small, what happens is the surface area, ratio of surface area to the volume will drastically change. And when any element, you make it into nanoscale, and when it into quantum dot scale, you know what happens? The chemical property changes. The physical property changes, mechanical property changes. So what we are doing in the ultra diluted drug is something which the current science is yet to achieve, and it yet to see. It may take another 10 to 20 years for the modern science to understand they are not modern. Homeopathy is much more modern than that. But we are on the way to do that. And everyone sitting here is part of that. So my dear doctors, this is platina. And I will show you something very interesting here. This is platina in 200 dilution, and that is 110 nanometer, and this scale bar is, just you can see here, this is only 2 nanometer scale. In 2 nanometer scale, you are seeing so many lines. And these lines are nothing but the atoms of platina is arranged. Every element, the atoms are arranged in a linear fashion. And when you go to 5 to 2 nanometer resolution in electron microscope, you will see the atoms directly. And these are the atoms arrangement in the scale. And you will see there is a space between. Between lines there is a space. This is called D space. And if you calculate the D space, you know what is the element exactly. And the important thing here is, I just wanted to tell you, this is platina 200C SAED pattern, that is selected area electron diffraction. And in selected area electron diffraction, as well as you can see the DLS analysis of platina 200C. Here you will find these elements, this circle you are seeing is the crystalline form of platinum. And this nanoscale particle in crystalline form here is nothing but platinum dioxide, which is calculated, and this calculation you can see here, this de-spacing analysis shows it is corresponds to platinum dioxide. Why it is so important? This is my most recent publication. You can see in the journal Homeopathy, published in January 13, 2023. And this is on platina and diluted alcohol study. And this platina is platinum dioxide. Why it is important? People say that homeopathy uses metals, heavy metals and poisons. They are toxic. But when you dilute it, when you potentize it, they convert themselves into oxidized form. Whether it is aurum or platina or arsenic, they become dioxide or trioxide. And this oxidation of the metal make them completely non-toxic. So question of toxicity of homeopathy of heavy metals is completely gone with this particular study, because every drug, when you dilute into that level, that become oxidized. Once it is oxidized, it is completely non-toxic. So my dear doctors, every question thrown into the face of homeopaths in the last 200 years is going to be solved within 5 to 10 years completely. And if we are lucky, our generation will see that it is true, and it will conquer the science of medicine, and people have to follow it. Even the complete modern medicine has to shift, other than the technology medicine. So my dear friends, this is silicia. Same, you can see 2 nanometer. You can see the small lines here. And this is the field emission scanning electron microscopic pictures of calcarea carb. And calcarea carb, carbo animalis, and Devi was telling about carbo animalis is such a wonderful drug for many type of cancers. We all use it so commonly. How it produces such a beautiful action. Carbo animalis and carbo vegetabilis have enough amount of oxygen, and they stimulate the oxygen reserve in our body. And when they stimulate the oxygen, these nanoparticles stimulate the oxygen reserve, the gasping for breath is gone with the carbo veg, because they stimulate the oxygen reserves in the body. So we have to go much more than this. But definitely we have some primary answers. And this is a hypericum. It's another important and beautiful drug we are using. This is the image of Lycopodium LM24. You see the particles. This is only a micro drop of medicine which is divided into, and where you will see a small area, 50 micron area is analyzed. So in 1 micro drop of homeopathic dilutions, you will find millions of nanoparticles of the original drug. Not 1 or 2 or hundreds. You cannot count it. That many are there. And this is the pure alcohol, homeopathic alcohol, which is diluted into 30C. There is not a single particle. So that if you want to have particles in any drug, we need to have a primary element that is a drug substance in it. And that makes homeopathy an ultra-modern science. And I will make a brief presentation for genetics, because here you know that the cell structure, the nucleus, and there the DNA transcription takes place. And this RNA splicing takes place, and RNA transports the nuclear code, DNA coding into the cytoplasm, and in the cytoplasm, ribosomes takes this RNA message and make the proteins. So protein synthesis is done at the ribosomes by the transcriptomes. And this is a method, in general we call it the process of transcriptome, which convert the RNA, DNA signals or DNA coding is taken, and that DNA coding is converted into protein. And the fundamental issue always happens in the DNA coding. It can happen in many layers, but if you take cancer, autoimmune disorders, the fundamental error happens at the level of DNA coding. How this error is happening, how the mutation happens. We know about genetics because we know genetics very little till recently. Only in the last 10 to 15 years, our knowledge about genetics is improved to a better extent. I can say even today it is very limited. So this gene expression is the complete process of transcription of genetic code in nucleus to translation of the RNA, then formation of proteins in the cytoplasm. This process is called gene expression. And homeopathic drugs works in the gene expression. Whereas the modern medicine drugs never ever works in gene expression. Any drug which goes to the genetic material, it is always toxic. That is why we had babies without limbs when they gave drugs in UK in 1960s, thalidomide. And every drug, when you give like that, they produce genetic toxicity. But homeopathic drugs never produce genetic toxicity, totally produce gene regulation. Because we are giving drug which is already proved. And when you give the drug for drug proving, this is an important question we should know. How we get symptoms? Because we all prove drugs in our body, we know it produces symptoms. How it produces symptoms? Because these drugs are penetrating into the gene system and the DNA, and it produces transient epigenetic modification. It is a drug stimulation. When you withdraw the drug, this will automatically come back. That is why it produces physiological symptoms and never produces pathological symptoms. But if you use a homeopathic drug for proving for months and years together, you have all possibility of landing up in pathological symptoms. I have seen it in one person. I have seen it once, and it was so scary, and it was a sepia, the guy was going on taking, which was given for proving he was going on taking for months together, and a small spot appeared on his back, and a large tinea lesion, completely the back was covered for months together. No medicine worked with him. And finally it has to go. So what I am trying to say you, we have a complete cycle. When you do the drug proving, you make a gene regulatory mechanism and take the symptoms out. So what we do when we take a patient symptom, mental and physical symptom, we are mapping the genetic material of human beings. Hanuman discovered the easiest way of mapping genetic material through the analysis of symptoms, because every symptom in our body, either thirsty or thirstless or any symptom, constitutional symptoms, are arising from gene regulation. So there is a genetic modulation which is happening every moment in our body, but it is within control. And here we have 30,000 genes, and they have produced structural proteins as well as they produce functional enzymes in the cells. And that is what we need to learn little more deep into the genetics. I don't have much time to explain. It is so fascinating, and where homeopathy works, we know. So cell and its function, we know very well. If you keep a single cell in an ideal solution, it can survive for months or years without any other support. So trillions of cells. In our body, we are having around 80 to 100 trillion cells, and each cell is independent. And each cell has similar 30,000 DNA genes in it. And in every gene, there are 100,000 coding material. So there are 3 billion coding adenine, thymine, guanine, cytosine chains. And if you take single cell and expand the DNA, which is coiled like a coir, it is 2 meters in length. And that is the length of a human body. And if you take the complete cells and extend the DNA, and you will get a chain which is larger than the diameter of our solar system. It is more than 20 billion kilometers. This is what we are playing with. And we think we are great people, we know something great. We are nothing. We are trying to see the corner, that's all. Because it is such a magical thing we are dealing with. That is what is called human being. But why homeopathy? I always say it is far superior. This is what I told you. Our nanoparticles are smaller than the smallest virus. The smallest virus are 50 nanometer. Whereas our nanoparticles are 1, 2, 5, 3, 8, 9 nanometer size. And that is why we do magic. When a patient is having dropping from the nose, in the beginning of a viral fever or a influenza, what we all do, Materia Medica, it is written, we give a dose of natramur and the disease disappears. It won't even appear. Why? Because these viruses are directly getting neutralized by these drugs which are so small. And here, the epigenetics, Dr. Ravi was telling, the DNA methylation, histone modification involved in the chromatin remodeling. And here, the epigenetic changes are potentially reversible by a number of small molecules called epidrugs. But in modern medicine, they use the epidrugs in cancer treatment. They are chemical constituents. But homeopathy, the epidrugs we are using is the nanoparticles, which is the nanopharmacology of homeopathy based on similarity, and that works the nanopharmacology of homeopathy as a curative therapy. 100% I am sure that homeopathy is a nanopharmacology which have ability to modify the genetic system. And this is a most advanced or the post-modern medicine. There is no doubt about practitioners who practice homeopathy and cure the patients. It is highly advanced. And it is a personalized nanomedicine. It is more subtle, where the particles can directly penetrate into the DNA and make regulations. We need little more knowledge about it. We need hundreds of doctors in the coming generation, to do serious research. And I can tell you, you will land up in the gold mine. And gold is waiting. You are not going. You have to go there. And you have to go there and you have to get it. And that is what the future of medicine. Don't feel based on the today's social structure. The social structure will definitely change within 10 years. Before 2030, you will see magical changes happens in the scientific world, social world, process of thinking. Because we have a process of thinking based on allopathy, which has to change. And the evolving basis is, 3 things are going to define the medical science. The more knowledge in genetics, more knowledge in nanoscience, and artificial intelligence. We homeopaths are trying to do what, We are trying to emulate the process of artificial intelligence, because we are connecting the patient symptom with the Materia Medica all the time, with miasm all the time. We are processing something like, it is like a Google process. It's artificial intelligence once comes into picture, I am 100% sure this become more accurate. It become perfect, because we have our brain limitation, whereas artificial intelligence, if we use properly in our clinical practice in years to come, this will become a perfect science, where you know what you are giving, what is going to be the action, how the result will come. It is going to be predictable, may not be the predictive homeopathy per se. So that is what, to few more slides I will show and I will close it down. And I wanted to say why I said it is a gene regulation. Already the researchers have proved it. Molecular biology and genetics research has shown in the last 10 years, undoubtedly, that homeopathic dilutions produces gene regulation. This is a contribution I have taken from Dr. Kudabaksh with his kind permission. And this is his personal slides which he shared with me. And he did these studies in 2010, 12, 13, 14 period. And he has published around 30 papers, more than 30 papers there. He has shown that in cancer, homeopathic drugs produces specific gene regulation. And this is one of the lab experiment with the experimental animals. And you can see the pictures, normal, carcinogen treated where the cancer cells have come, and also succussed alcohol without result. Whereas carcinoma treated with CKL 30, you can see there is a drastic change. And here, the results are, how the results are produced, he did analysis on the protein synthesis. And here, he has come down with a definite thing that there are genes upregulated and there are a set of genes downregulated. Because oncogenes, once they are upregulated, they produces cancer. And if you downregulate them, downregulation is a switch-off, switch-on mechanism where a gene can be kept off position. So you never get the disease. If it get on to their own position, you will get a cancer or any other disease. This is another study on the basis of gelsemium, and they can find around 56 genes are modified. When experimental study one done with gelsemium, 56 genes, 6 of them are upregulated, remaining are downregulated. Now we can do these studies. It's not very complicated nowadays. Only thing we need to spend a lot of money for that. You can study the complete 30,000 gene of a patient before treatment and after treatment, provided if you are willing to shell out 80,000 rupees per patient. I'm sure people will do that. Because that will take out the complete mystery of how the cure is taking place. So when you compare the conventional medicine, which is the talk of the town, which is the biggest thing in the world, biggest industry in the world, biggest medical system in the world, you know that it is most important in life-saving. It is a life-saving method where the treatment of chronic diseases are completely failed. And it is a product of Second World War where the life-saving was the biggest purpose, and for that purpose the system was created. And the science was reduced into that point. So to cure the chronic disease, it originates from the complex genetic system, and we need, we don't need anti-diabetic, anti-hypertensive, antibacterial, antiviral. It is a failed concept, it is a failed philosophy, it is a failed method. Definitely, you know, antibacterial drugs are on the edge of complete failure. So the present research finding, for me in the last 15 years, I found homeopathy is truly a personalized nanomedicine. Modern medicine is trying to make personalized medicine. They can never do that without changing their philosophy. If they change their philosophy, then their system will collapse. It is a dilemma for them. Therefore, when we are taking half an hour, 1 hour time, a homeopath around the world, sitting with the patient, talking to them, trying to understand the mind, trying to understand the emotions, trying to understand the cravings and aversions, trying to understand how they sleep, how they walk, their body language. We look at many things, even the smell of the sweat. And you know that you are mapping the genetic system of the patient. We are not doing a simple work. We didn't understand that we are doing the genetic mapping, but now we know that we are doing the genetic mapping. So it is a time to realize that homeopathy nanopharmacology makes genetic modulation and it cures the patient. And we can make it universal. Now we are not able to do it universally because we treat a lot of cancer patients, autoimmune patients. We get extraordinary result in many patients. Sometimes we miserably fail. This is a part of practice. And this failure part can be reduced and made into zero if we utilize the new knowledge in the years to come. So these are the important works I have done on this nanodynamics. Many of you read this book, and the second edition of the book is recently published by B. Jain. And this is The Ray of Civilization. My last work on 2020, it was published, and it covers a lot of topics because medicine is not a science alone. It is more than religion. The influence of medicine in human life is more than religion. So we need to understand this medical science in the perspective of civilization, rather than perspective of local politics and IMA or any associations. And these books are already there. You have seen my thoughts and my research and my clinical studies are all documented in this. And on this research, I have done 10 international peer-reviewed paper presentation in nanotechnology alone, and I am hopeful that in the coming years, integrating this nano knowledge into the genetics and in the gene regulatory mechanism, we are going to have a new science which is more than what homeopathy we know today. Thank you so much. Thank you, everyone.
Thank you, sir, for giving a wonderful insight in the field of homeopathic research. I now request Dr. Arunapriya, Treasurer of CHDA, to please present sir with the Dr. Samuel Hahnemann Award and with a check towards his work in the field of research.
A small word of thanks. I am doing research for the last 12 years. I spent many lakhs of rupees from my pocket to the laboratories. I never took any money from anyone, and I even asked anyone. But the first time, the Coimbatore Homeopathic Doctors Association is giving a contribution. It is more than that. It is a matter of love for me, and definitely I appreciate that, and I am so thankful. And this money is directly going to a genetic lab. My genetic research is already on, and this contribution is, I consider, it is a small tree which is going to grow, and hundreds of homeopaths around the world will do genetic studies in the future, and this will be the greatest tree which is grown from a small, as a small sapling. Thank you so much.
That's why we want to be part of you, sir. Yeah, the research that you do and you have done, we want to be part of this.
Sure.
And we'll always be part of this, sir.
Thank you.
Please give a loud round of applause.